Morning, everyone, and welcome. Good to turn on my mic for things to work. So we're convened here as the PHAC Board of Health Retreat. We have an agenda before us, and I think maybe let's start with introductions. I'll start. Sue Marshall, I chair the Board of Health and the Clark County Council.
Alan Melnick. Forgot to turn it on. Okay, that's the first thing. Alan Melnick, I'm the Public Health Director and I'm the Health Officer. I'm an ex officio member of the Public Health Advisory Council.
Dr. Kevin Fisher, I'm the medical doctor practicing in Clark County.
Jeff Harbison. Wow. I'm the Administrative Services Director for Clark County Public Health.
Emily Estes. I am a consumer of public health and the Vice Chair of the Public Health Advisory Council.
Lori Schott, on the Public Health Advisory Council and representing social services.
Andrea Pruitt, Community Health Director, Clark County Public Health.
I'm Sandy Brown, and I represent Consumers for Public Health Services and Chair of PHAC.
Tyler Clary, PHAC member and representing water utilities in Clark County.
Tracy Fernandez, PHAC member representing Peace Health Southwest.
Mark Collier, PHAC member representing septic inspectors, installers, and designers.
Glenn Young, County Council and Board of Health.
And online.
I'm Brian Scarlett Pfizer. I'm a PHAC member and representing Legacy Salmon Creek Medical Center.
Hi, this is Michael Watkins.
Go ahead, Michael.
Oh, sorry, Matt. This is Michael Watkins, Tribal Manager for the Cowlitz Indian Tribe, representing the tribal aspect.
This is Janine Mills. Oh.
Go ahead.
This is Janine Mills Goodling, PHAC member, and I'm representing the educational community.
Good morning. This is Danette York. I'm the Deputy Director for Clark County Public Health, and apologize I can't be there in person. I did a brief travel trip over the weekend and ended up with COVID.
Jordan.
Good morning, everyone. Jordan Bogey, Senior Policy Analyst. I support the County Council.
That's all.
Okay, thank you, everyone online. We're happy you're here. And we have just someone walking in now. We're just doing introductions, Scott. So I hate to put you on the spot, but you just have to introduce yourself.
Scott Johnson, I'm the Emergency Manager with Clark Regional Emergency Services Agency.
Great. Thank you. I think that's everyone now. Just reviewing the agenda, I guess that was our first thing, but let's take a look at the agenda. Is there anything to add? It looks like there'll be a number of updates, and then I think we can just have some open discussion. So help yourself, those who are in the room, to coffee and refreshments. And if people were kind of spread out here in the room, so if people want to move a little closer or wherever you feel comfortable, but I know some of you are way over there.
Chair.
Oh, closer to the food. That makes sense. Yes, Sandy, did you want to say a few words?
I just wanted to say good morning, and
oh yes, did we miss you? Go ahead, Matt.
I was just hoping.
Okay, welcome. Go ahead. Oh, okay.
He's in Montana.
Matt, we can't hear you, but we're ready to listen. Well, keep trying, Matt, and whenever you can chime in, we'll oh. Okay, well, if Matt chimes in, we'll stop and listen. Go ahead, Sandy.
Well, I just wanted to thank you for the time for us to have a chance to visit with you as a Board of Health. And we just wanted to have some time to open the communication and talk about our perceptions and our interests and our impacts of some of the things that were presented in the public health in action presentations. We thought that would be a good place to start, to talk about our perceptions, impacts, and maybe questions we have for the Board of Health regarding those issues and what might be going on in the community around those issues. And so that's kind of what we were looking forward to doing today, and really appreciate the time to be able to do that.
Great, sounds good. Now there's a review and summary of our last retreat. Dr. Melnick, were you going to be doing that?
Chair, we need to actually approve the last minutes from the last retreat. And I'll go ahead and pull them up. I'm sorry. This is kind of a new to the Board of Health back retreat process. So I'm going to go ahead and pull them up now.
Sure, we're going to be able to see them.
Yeah. We could move the minutes to the bottom of the agenda, and then if there's copies, people could have a chance.
I think I have the same thing up on my computer. Huh?
Okay, they're up on the screen, but I can't read it, so.
Well, I can read something, or they're here on my computer as well. So if you can see up there, Mallory, make sure that I'm getting it correctly. So I don't have the presentation. We can pull up the presentation as well. It's embedded in the minutes. That's at first. I don't think we want to go over the whole thing, but we discussed we reviewed core public health functions, assessment, policy development, and assurance. The public health works to improve community health by addressing the social determinants and working upstream. So we did a review. We did some basic public health review. We talked about essential public health services. In Washington State, because we're in Washington State and we get funding, we talked about the foundational public health services and just got everybody up to speed on that. There's a quiz for all of you today, by the way. Make sure. And then we talked about the process we use that Clark County Public Health uses to bring issues, community health issues, to both the Public Health Advisory Council and PHAC. We talked about a little bit about the Bar-High framework. Andrea is an expert on that if we want to pick her brain, about that's the Bay Area Regional Health and Equities Initiative. And it helps us frame issues around health equity. The issues we bring data that includes information on behavioral health, physical health, substance use, and communicable diseases. And, as an example, and I think we did this with just recently with both groups, we need to focus on improving immunization rates and address social determinants and advance racial health equity. So when we do these, we bring issues to the both groups, both PHAC and Board of Health. We try to look upstream, look at social determinants of health, and also address equity. We reviewed some case discussions involving the public health ethics model and discussed how Clark County Public Health can bring community health issues and challenges to both PHAC and Board of Health for future deliberations. Then we talked about I hope I'm getting it all because I can't see your version up there. We reviewed the RCWs related to the Board of Health. And by the way, if we have time, I want to really discuss, when we talked about possible policy issues, I want to bring up the RCWs and the WACs, the administrative code, because changes at the federal level might be reflected in how the RCWs and WACs are interpreted. We reviewed the Public Health Advisory Council's role as in statute, and then we talked about different models. The current model, the Board of Health FAC model, and then we discussed the Board of Health model without a Public Health Advisory Council, but instead having non-elected members on the Board of Health. And the next steps, we wanted, everybody agreed to increase interaction between FAC and Board of Health. We entertained, we thought we could explore an idea of having the Board of Health meeting at a time other than 8:30 in the morning, possibly in the evening, so that FAC members who had other jobs could attend, to get FAC attendance up. And then we considered having quarterly facilitated discussions for prioritizing work and taking a more strategic approach. This we actually got the answer to. We wanted to ask the PA about the feasibility of having both models at the same time, Board of Health with non-elected members and a FAC at the same time, and that is a possibility that could be considered. FAC was going to explore the idea of adding more council members, Board of Health members to the advisory council, and then I think it was, yeah, and then invite the Wausau managing director to meet with the Board of Health to give an independent view of the different structures and different models, and that's already occurred with FAC. We had that meeting, and we plan to have Jamie Bowden, who's the managing director of the State Association of Local Public Health Officials, come and meet with the Board of Health to give the same presentation that FAC had about the models. And that was it. That's the summary. Now you all remember, right? We don't have to do a quiz.
Great, thank you for that. And I guess with that, are there any questions or additions? And if not, I'll entertain a motion to adopt the minutes of our last meeting.
I so move to adopt the minutes.
Thank you. Is there a second? Second. Moved and seconded. All in favor say aye. Aye. Thank you. Thank you, Ellen. Okay, now this is a formal setting, and the microphones and everything can be intimidating, but I really hope that we can just have a more informal give and take. That I think is the intention. Yes, Michelle.
And also remember that when making motions, please state your name for the record, so we have that for the minutes moving forward. We don't forget who seconded the motion.
Oh. Mark Collier seconded. Thank you for the reminder. Okay, so I have added to the agenda RCWs and WACs, as Dr. Melnick suggested. And I think not on here, but since it was mentioned in the minutes, the model of...
Chair?
Yes, go ahead. Oh, is there something in the chat? I think that I picked that up. We'll check the chat, Matt. Because otherwise you're breaking up.
Yeah, it's requested a discussion about PFAs and CAMUS number 13.
Councilor Little has requested to add to the agenda discussion regarding PFAs and CAMUS Well 13.
PFAS, okay, and CAMUS Well 13.
Yes.
Okay, thank you, Matt. We got that. And I would like, if we could, have an update on Columbia River mental health, if that's the status. Sure. Great. Okay. Okay, let's jump right in. Discussion of how PHAC can provide input to the Board of Health on potential public health policies, including local and state policies and budget. Who would like to kick this off? Anyone who makes eye contact. I may call on you. Go ahead. Please state your name.
This is Lori Schott. Sorry. One that stands out to me, I guess I was struck by the information on each of the presentations, but especially with the access to prenatal care. And what we see a lot with the social services in domestic violence is reproductive coercion, or folks, not having access to contraception, or having feeling the need to stay in abusive relationships because of children. And so that is compounded if they don't have access to prenatal care, because that also can be where the screening might be, where they could be linked into support services for safety planning or other things for the safety of themselves and their children. So we see that a lot, and I'm really concerned without the access to the care that's one more barrier and one more isolating factor that people might feel forced to stay in an abusive relationship or not have access to the social supports.
Maybe we could just take these one at a time. No. This is just, you've informed my sense of direction for this agenda. So that's good. Because I think there are additional things to say related to prenatal care, because there was, and I think, phenomenal effort on the part of the health department to pull together that summit. And there was a lot of enthusiasm. Is there any follow-up related to that, or things that we should be aware of?
I guess I just want to echo what Lori said, is that I was really amazed in the presentation about the lack of access for care in our own community, and concerned about what we as PHAC or what the Board of Health or we as a community can do to help that, whether it's legislative policy or something that can help support to get more care for these underserved populations or the populations that can't get care. So like I said, I was really impressed by the presentation and concerned at the same time. And so through this conversation, more about what PHAC can do and what we as our members with our constituents can help support that, but also how we can work with the Board of Health if there's any possibilities for policy changes or legislation issues around that.
Thank you, Sandy. I think the Board of Health was equally concerned about that, and I think that led to a directive to let's dig into this and really develop an action plan. Dr. Melnick?
So we had a meeting with Senator Cleveland, who's at the summit, and discuss the issues. And there's a number, I think you've probably all seen the summary of the summit, but a number of things looking at unbridled payment structures, maternity care payment models, getting healthcare providers to accept more patients with Medicaid insurance, workforce issues. Those are some of the potential policy issues. We met with Senator Cleveland, had these discussions, and decided, and I've actually reached out to Senator Harris's office. Haven't had a response back, but I think we can start engaging with them this fall on potential issues. We met with, we reached out to, I'm not sure exactly how, did they reach out to me first? Or did we reach out to TVC first? But had a discussion with the Vancouver Clinic. They have a really interesting model, and I'm not sure, I'm trying to remember exactly how I heard about this, but they have a model where they have group visits and they actually are using, in terms of workforce, using nurse midwives. So they have and I think it's in partnership with Peace Health as well as Legacy as well. I got more to say, but go ahead. Yeah.
Yeah, they are trying to come together and try to solve the issue about access. TVC does have a very extensive midwifery program. Peace Health does not. We just have traditional OB physicians. And I think part of the access issue is the lack of OB physicians in the community. And we just don't have enough. And I think it's a shortage in a lot of areas, not just here. And it's just trying to get providers to come is a big key. And when you're competing for providers that can pretty much go anywhere, it's how do you make yourself look attractive? So, and I think we are considering a midwifery program, but those take a long time to set up. TVC has been working on theirs for a really long time.
So the plan is to convene a group of stakeholders. So we've got, I think I believe we are reaching out to Peace Health, Vancouver Clinic, Legacy, as well as Molina, because they're the main managed care MCO in Clark County, to have a discussion about what we could possibly put in place. It's not going to be the answer to the problem. But if we get more midwives and do more prenatal care, we could do a better job of doing some screening, like HIV screening and syphilis screening. There are a number of, we can actually increase or get people into prenatal care earlier if there's more of those services. It's not the end all answer to the problem, but we are going to convene a larger group of stakeholders and see what ideas we can come up with. Andrea, I don't know if you have anything to add. You were part of that meeting, so did I cover it?
I recall there was also some discussion looking at other states and maybe other models and whether or not Clark County, and maybe I think there were some other counties interested as well, as being some sort of demonstration or pilot project. So is there progress on that? I don't know what the details of that might even look like.
It's Oregon, I think. Yeah.
Yes, we have engaged in some of that research about other models and the potential for a pilot. I think that in our follow-up meeting with Senator Cleveland, she wanted some additional information about what we were going to do locally with the centering pregnancy model with the Vancouver Clinic. Any carve out that we would be successful in applying for with the healthcare authority to try a different model would likely require some state support from our elected officials as well. So hoping to schedule another meeting once we have some conversations locally to see what that could look like as a part of next legislative session.
Thanks for mentioning that. The model is called, that group visits with the midwives, called the centering pregnancy model, and I forgot that. One of the things we might do is also reach out to Oregon, because they have a somewhat different payment model. They use coordinated care organizations, and that's another discussion we can have as well.
I think it'd be good to get a follow-up on that, and what a timeline might be to move something forward. It sounds like there could be a lot of work involved to coordinate that. I would suggest, Andrea, you switch out your microphone because you were faint. Thanks. So might there be some legislative suggestions for this upcoming session? Or do we know that yet? Not necessarily with the model, but related to prenatal care in general.
So based on the conversation that we had with Senator Cleveland, I would say that we're not there yet. I don't know that we have all of the pieces to the puzzle to be able to make a recommendation at this point that would have the level of support that we would need. So we're going to engage in a couple more local conversations with providers and then figure out what, if anything, we could and should recommend that would be appropriate given the capacity that we have locally, both at the access level with providers and then anything that would get adopted in terms of modifications to some of the data pieces and the transparency. So I'm hopeful in the next 2 to 3 weeks that we'll have a better idea of a potential legislative ask that we could make for next session.
Great. That would be helpful, I think, just communication wise, if we get regular updates as there's something to report on. Thanks.
Yes. As soon as we have something meaningful, we'll bring it to you.
Great. Things can get lost, I've found in my experience in working with local government. Any other thoughts related to prenatal care at this point? I'm glad we're both the PHAC and the Board of Health are focused on this as a priority.
Only that we're in the process of, Mallory, I think you're trying to schedule that meeting with, I think, CEOs of Legacy and PCEL. Sherelle's invited, and the Vancouver Clinic. So we're working on that. And Francis Gal from Molina. So we're trying to schedule, it's hard to get everybody together.
Great, thanks. I don't know, is there any follow-up on benthic algal mats in the Columbia River?
I don't know that there's a policy issue around it. I think that's more of a community education issue. I don't know what other folks think. I think there are policy issues related to the other form of algae that's affecting our our lakes, our standing bodies of water, but it's more of getting the message out that it exists. I mean, we have many, many miles of the Columbia River as well as other rivers in Clark County, and there's these benthic algae mats could be all over the place. So, yeah, go ahead, Mark.
Is there any information about where they treat Vancouver Lake, where the algae blooms some way? Have they done that, or?
They're talking about other methodologies now. I heard they were looking, I'm talking off the top of my head without looking at my notes now. I'm not prepared, but I thought they were looking at using aluminum or something to have it settle out. My bias about hopefully the long-term solution for Vancouver Lake is to increase the water flow into the lake. The problem with algae is it's going to get worse as the climate warms, and the two factors that stimulate algae production are nutrients, and we got to get literally upstream and reduce the amount of nutrients in there, as well as climate that's making more warmer days. Our algae season is longer than it ever was before. And certainly increasing the flow in Vancouver Lake would help as well. That's a long-term policy solution, and source control is another big issue that we can delve into if we want to get into it more.
Go ahead. Go ahead. No, you go ahead.
You were probably going to say the same thing as me, is that the council held a work session last week. And so if you go to our meeting, and you can watch that if you want. It has a whole update of where we're at with Vancouver Lake.
You mentioned, Councillor Young, about that. Was it aluminum they're going to use to get the algae to? I'm trying to remember what it was.
We didn't really discuss like chemical treatment. We really discussed generally how we can solve the issue as a whole. And there are some options that they've come up with, but there's some more work that needs to be done for us to refine those different solutions.
Yeah, the algae side, I had some concerns last year because you can have algae sitting in the lake with toxin levels not elevated, but when you get a die-off, you can get toxins released. So I had, we'd still have to post the lake even if they were algaciding. Anyway, that's another long story. I don't want to get off track, but
If there is interest in both Vancouver Lake and Lacamas Lake, because I think they're both two lakes that have some similar problems, but also very different lakes. But that work session that Councillor Young mentioned would be good to look at that, because there's a handout and there's detailed different approaches with different price tags. It's a long-term effort to keep Vancouver Lake. I think it's a lake that really wants to be a meadow. So there could be some kind of heroic measures to keep it going, but it is really valuable as a recreational resource. Milfoil was the other thing of concern, and it may not be toxic, but it's a nuisance and undermines the recreational aspect. So the council did agree to pay to treat the milfoil. But the Clean Water Department might be worthwhile for the fact to get a briefing from the Clean Water Department on recreational uses of the water. There's an intersection there. Okay, I'm going to go down the list here. The Heat Watch campaign. That was really interesting information. Does anybody have any follow-up concerns or thoughts related to the heat map? I know all of the cities in the county are going through comprehensive plan update. Climate change is one of the new goals we have to respond to, so that heat mapping information can be helpful in informing practices that we do across the landscape. So I'm not sure the specifics of how that will play out, but the planning is underway. Anything else anyone wants to say related to the heat watch? Climate change? I'm taking turns at looking at one side or the other of the room. You can look away, you can look down.
This is Sandy Brown, and I'm glad to hear that there is that conversation about climate change and the mapping project being part of the update to the master plan and planning and so on, because it really struck home with me about how there's areas in the community I drive through that were lots of trees on them, and now they're not there anymore, and there's multiple apartment complexes there, which is great. I know there's a need for housing, and so that balance between the need for housing and then the effects of taking away some of that green and that cooling area, what does that do to our environment in our community, and how does that increase that heat zones there? So that was going to be my kind of input, is that was what struck me. And I was hoping that as we went through in the planning process and as we're trying to increase the opportunities for housing in our community, making sure that we're not making our community hotter, and that it's going to take more power and more utilities to try to keep us cool, and the risk to our community, because we're getting rid of some of our forests and putting apartments or parking lots or more cement.
Great. Well, we'll be having those conversations, and I would just encourage the fact to not just communicate with us as the Board of Health, but communicate with the County Council related to the comp plan update. If you want to take a position that ties in that heat mapping work that was done and concerns about development or how we develop. Great. Okay. School immunization rates. This is another one that we get regular updates on. The trajectory is really going in the wrong direction, and it's a tough issue. So, we need to continue to monitor this. I think if there's outreach, public education, I don't know, or what resources we need to put in related to school immunization rates, but it's a significant issue. Thoughts, anyone?
Can I just add something to that? There's something that's come up recently, and so public health is a state function, so the federal government generally doesn't get involved except through funding and interstate commerce. I mean, but so the powers around dealing with things like immunizations are states that delegated to local governments. The Association of State and Territorial Health Officials put out a notice saying that you may want to take a look at your state statutes and administrative code because changes at the federal level can actually affect that because they're written in statute and code. So, so around immunizations and how we approach immunization rates and how we approach outbreaks in schools, one of the concerns is our ability to respond to outbreaks that might require things like exclusions from school. But we took a look, and I worked with the state health officer on this, took a look at some of the RCWs and the WACs, and lo and behold, the ACIP is actually referred to in state statute or and WAC, at least one of the two, because I looked at the WACs, he looked at the statute. So basically, the WAC chapter 246 actually mentions using the ACIP immunization recommendations in terms of how we address immunizations in the state. And if there are changes there, we need to, one of the things I want to bring to here, as well as we're talking about this among state partners, is taking a look at, and this may be an issue for the legislative session that we may need help on, taking a look at those. If they're WACs, I imagine it can go to the State Board of Health for change, but if there's wordings in the statute, we require legislation. So I just wanted to bring that to folks' attention.
That sounds like a large issue. And what does ACIP stand for?
The Advisory Council or Advisory Committee on Immunization Practice. I may be getting the acronym wrong, but that's the group of folks, of experts who basically recommend vaccination, the schedule, the recommendations. It's the ACIP.
And that's a federal?
Federal, yeah.
Federal.
It's an advisory committee to the CDC, HHS. That was the one that.
The makeup has
all the members
changed.
were just fired and replaced.
That's.
I'm not on speed. Yeah, those are, they're part of their federal committee, and they were just recently fired and replaced. If you've been seeing the news about that.
Great. Well, keep us advised on that. And I would say to Jordan, our policy person, to put a star by that one so we can, and in as much as we can be proactive, we can be in a more proactive stance.
Yeah, if I could just add in on the immunization presentation that we received. So we just actually saw this one, I think it was last week, wasn't it? And I just wanted to make the Board of Health aware that this was a subject that I've been on the FAC for a while now, and there was a lot of passion in the room on this subject. There's a lot of concern from the FAC members about the low rates that we have in the county comparatively even to the rest of the state, and just trying to come up with ideas on how we can improve those rates and make sure that our kids are getting immunized. But I just want to make clear there was a lot of passion there in that room.
Thank you. And there's a whole lot of misinformation out there as well. So it's hard to counter all of that. And just thinking about that, I know the FAC meets the night before the Board of Health convenes. And I think we're often just given the same presentation. But if there is any feedback from the FAC that could be conveyed just the next morning when the Board of Health meets, I'd just encourage you, if you have any special thoughts you want to pass on, I'd encourage you to do that, because I'm just thinking about cross communication as we go forward. Go ahead, Sandy.
Yes, Tyler's right. I think there was a lot of passion that night after we seen that presentation and a lot of comments back and forth. And I think one thing that struck out to me was that, is there any possibility for any legislative changes on like who can be exempted from immunizations, and how could we support that if that was something that was possible?
So, so you might recall that in 2019, I think we brought this up when we had our measles outbreak. Washington, there are three major types of exemptions. I'll learn the fourth about religious organization, but it's, philosophical exemption, which is a personal exemption. These are exemptions from the school requirements. A medical exemption, which is really rare, and then a religious exemption. So in 2019, when we had our measles outbreak, following that, we had a bipartisan effort. You might recall Representative Stonier and Representative Harris, now Senator Harris, sponsored some legislation that removed the philosophic exemption for the only thing we could get through was for that one vaccine, the measles, mumps, rubella vaccine. And we were able to remove that exemption. Unfortunately, after that was done, the religious exemptions went up. Medical exemptions are incredibly rare. So that could be done with the other school required vaccines. And then Washington is different. Every state is different. And some states do not have not only personal, philosophic exemptions, some states don't have religious exemptions either. That would be a push, but that those are some things that people could consider.
What was the actual result of that law changing, the exemption changing? I know there were more that went for the religious exemption, but overall, did the immunization rate increase?
That's a tough one. I'm speaking as an epidemiologist here because during the outbreak, we had a huge number of people, both adults and children, who got vaccinated. And if I showed you the graphs from January and February and March of 2019, lots of people were going out and getting their immunizations. Then what happened is, and then following that, we had the pandemic. So the immunizations went up after our outbreak. They went up significantly, but and that was before the exemption. But the exemption was removed in late 2019, and the pandemic began in it's COVID-19, so it started in 2019, but really hit us in 2020. So, and immunization rates have been creeping down over the last couple of years. So it's hard to do cause and effect in terms of this.
And I do agree that it would be a difficult push to get further remove some of those exemptions. It's worth having a conversation with our delegation. I think just share with them, what the immunization rates are and the concern about that. Go ahead.
So this is kind of on the prenatal care thing, and on this, I got the opportunity to speak at the prenatal care summit that we had, because when I watched that presentation, I realized my own children and my birth were in that data for not having been able to access care until the second trimester. And one thing that kind of came up in that presentation was how difficult cross-state information is. And so for me, I eventually got care in Oregon and when it's able to access it there, and then struggled through the rest of that pregnancy to go back and forth with Melina on whether or not I was even able to do that. And so my kids were born at OHSU and their pediatrician is at OHSU. And what I learned in this presentation was that their vaccine records might actually not be being counted for Clark County because they happened in Oregon and not in Washington. And so for prenatal care and for this, I just think about the fact that they talked a lot about denominator inflation in that last meeting, and how, you know, if you look at the state, only 5%, about 5% of kids have an exemption, but in Clark County, it looks like 10%. And I wonder how true that is. Like, I wonder how true it is that kids are. What are you going to say, Dr. Malik?
So it may have been a little bit confusing. So there's two sets of data for immunization. So you've got the registry, and you're correct that any child with who's a Clark County resident gets entered into the state immunization registry. It's called the Washington Immunization Information System, or WAIIS. And if they get vaccinated in another state, that doesn't often get put into the registry, so they're not counted. But the data that we're talking about in terms of school exemptions is based on this, the schools require documentation from the parents, have to bring, whether they got the immunization, whether their child got it in Oregon or Idaho or wherever. That's a different data set. And the parents are required, you'll be required when you want to enroll your child in kindergarten, will be required to bring either proof of, you know, a vaccination, get your child vaccinated, or get an exemption. So when we're talking about the K through 12 rates and the kindergarten rates dropping, that's based on what parents are bringing to the, like, the exemptions aren't even in the WAIIS. So, and the other thing I wanted to say is that I believe the K rate right now, the kindergarten rate, is lower than the K through 12 rate, which concerns me that the new cohort coming through, the younger children are less likely immunized than the older ones. So I'm not sure I'm addressing that as well, but I just wanted to clear that up.
That's good information. And also, I think just my point is we're kind of a unique border county. Like, Clark County specifically has this opportunity and maybe a need to have better communication across state lines in a way that other counties don't, whether that's for vaccines or whether that's for prenatal care access and just clarification. Because as far as things that we can do as a county, you know, I have about a decade of experience also connecting clients to medical care and access to that. And I have had that challenge over and over of having to go through Oregon and have there not be a clear pathway. So just as far as things we can do as a county addressing either of those things, I don't know how we can increase that communication. I don't know if that's the healthcare authority or if that's the providers themselves or if that's public health.
Thanks for raising that. I don't personally know how to do that, but it does seem as though there's a need to do that, and us being uniquely positioned across from Oregon. And I don't know how many people are going to Oregon for care. That would be good to understand what that is. I don't know if anybody else has thoughts on that, better coordination with Oregon or even communication.
Just speaking for Southwest and our physicians down here, we do have a primary care shortage. It does take a while to get into a primary care physician. I think that's probably runs up and down all the states with primary care shortages. And we do send, obviously, most children that need high medical needs over the river to Dornbeckers and that, because we don't have that here locally. But other than that, we don't send people, so they would be actively seeking to go across the river because they can't get an immediate appointment here.
Which leads me to think about the other, whatever is bad around primary care, especially for the Apple Health population, it's going to get worse because we're going to be seeing cuts in Medicaid. And that's something, Medicaid is a state program, so that there certainly relies on funding from the feds, but it is a state program. So we need to be actively involved in that as well.
My experience as a service provider and as a patient myself has been nobody seems to know how these things work across state borders here. And it's something that when I've been connecting clients with care, they've also struggled with. I know for a fact that Molina will pay for an organ provider if it's needed. But at the same time, if you call Molina, they're an out-of-state customer support and they say, no, you couldn't see that provider. There's no way that you were allowed to see that provider. They're an organ. I'm going, I've done this for 10 years. So clarification on that, I think would help all of those things.
Thank you. Anything else? Go ahead, Councilor Young.
Yeah, I just wanted to circle back on the religious exemptions. You know, I'm a believer in vaccines, and I believe it's important for us to try to get as many as we possibly can. But I'm also a person that pays close attention to unintended consequences. And especially when you're talking religion, you might have a high percentage of parents decide to unenroll their kids from school as opposed to get them vaccinated. So I think that is something that should be considered when you think about that.
Yeah, certainly we need to think about any decision we make about unintended consequences. Absolutely correct.
Mark Collier, I'm just wondering if there's a way we can enhance the delivery of the vaccinations through more clinics or just kind of a Clark County emphasis. I know there's that sort of element prior to school, but it seems to be maybe not enough in order to try to get the rate up. Or is there something we can do to enhance?
I just want to say something real brief here. It's interesting how the personal exemption came up. People would show up at schools with their day of enrollment to get their child into school, and they weren't immunized and they couldn't get in. So the personal exemption was a way for people that may not be philosophically opposed to vaccine, but it's just a hassle to get their kid vaccinated. And they sign a form basically saying, I have a personal exemption. Back in the old days, I mean, and we're a long way from this, but I'm just going to bring it up, that, vaccines used to be provided in the schools so that a parent showed up at the school with their child, need a vaccine, they could get it right there. Since I've been here, and I've been here 19 years now, I don't remember that being done, but I think in the past, it may have been available, but you're certainly right. Access is a big issue.
Yeah, we actually don't have data to explain why these folks that are taking the philosophical exemptions are doing so. And I bet convenience or just urgency of enrollment is a big part of it, especially we've identified primary care not being available. And then in particular, this cohort that's coming into kindergarten and first grade now, they were of age when they would have usually been getting vaccinations, but that was a time when we were really constraining in-person medical care. And so this, I think in my mind, I build this view that these are anti-vaxxers and reading things on the internet, but that may not be the case. It may just be the logistics of getting the vaccine.
I think that's a great point. This is a data need really to really understand. And I agree about the unintended consequences and just the whole backlash related to COVID and mandates and all of that there's public awareness campaign. And I don't know if there's other states there, other communities that have really done a great job with public awareness, but I think the data to inform, and then that could inform a public awareness campaign would be important.
This is Lori. I certainly forward along a lot of the emails for the clinics, the vaccination clinics, and it occurred to me I have no idea what the response is for folks accessing those. Like, is that an effective one? I'm hoping it is, and bring it to the community. But yeah, I know we've got those around, especially during the summer, but it'd be great to know if those are being utilized.
And I think when there's an immediate outbreak, and I know in the 50s when we were all lining up to get our shots in schools, it was polio. People were afraid. It was devastating. And, you know, the response when there was a measles outbreak locally, you know, people could see, you know, there's an immediate threat. So I think if it seems far away or they haven't seen anyone with that particular illness, it seems less urgent. Yes.
Brianne in the chat wrote, what about approaching local chain pharmacies for free vouchers?
Free vouchers for vaccines. I think that's a good thought, making it as accessible as possible. But I think that you know, everyone wants things as convenient as possible. Yes, go ahead.
Yeah, I was just one of the access is definitely a huge issue, right? And the more resources that we can provide, the better. So I'm wondering, like, what kind of activity does Clark County Public Health, what kind of school vaccination programs are available that maybe we can tap into? I know that there's been a lot of budget squeeze, and but if there are resources out there, maybe providing that information in, like, for instance, you know, within Legacy's primary care clinics and, you know, our emergency rooms, and just getting higher visibility of what is actually out there.
Great, thank you. Is there any response to that comment as far as the outreach that's happening? I think, yeah, Dr. Milnick, if you have a response.
Yeah, it's interesting. You know, the work we do in promoting immunizations, like the educational work, partnership work, is a foundational public health service. But actually putting the shots in arms is considered direct service delivery, so we don't get foundational public health services funding for that. It's been an interesting discussion because fortunately in Clark County, we have other, not that access isn't an issue, but compared to some of the rural counties, we have better access. And it's been an interesting discussion statewide because rural counties really need their health department may be the only service provider in the county and can't get FPHS funding to do that. We're not equipped. We don't provide, the only direct service we provide clinical services is our home visiting program, our nurse family partnership program. We don't directly provide immunizations. And I'm not sure it would be, given our structure, I'm not sure what that would be the most efficient way of getting increasing access in the community. I think we need more access points from providers around the community. I don't know if any Andrea is going. I don't know if you had a quick point on that, but that's okay. Go. Yeah. Right.
I can't hear her.
We don't have the capacity to do that through our nurse family partnership program, and they wouldn't be seeing enough. I mean, the numbers wouldn't be huge enough to make a huge dent in the immunization rate in the county.
Do all of our exemptions require a doctor's signature? I know some of them do. If we're talking about kindergarten exemptions and vaccination rates, are those people who are getting exemptions, do all of them have to have a signature from a provider saying that they saw the provider and signed off? We talked about that at the PHAC meeting.
I'm sorry, to get are you asking about a medical exemption? I'm sorry, I can't hear you very well.
In any of the exemptions that kindergartners are getting or school children are getting, are they always are they always getting a note from a provider? I know in some cases they are, but I'm not sure if that's.
I'm not sure, boy, Brianna presented that. I know that I believe for a philosophic exemption, I think even for for religious exemption, they're supposed to say that they had a discussion with their provider about immunizations. Is that correct? Or, thank you.
Hi. Maybe I should not touch that. Hi, Brianna De Silva Batia, Deputy Health Officer.
Get a little bit closer.
Can you hear me? Okay. I can answer that question. So there's the 4 exemptions: religious membership, medical, and then philosophical. The only one that does not require a discussion with a healthcare worker or physician or clinician is the religious membership. Because in religious membership, the family or parents have a religious belief in no medical care. So requiring them to be seen by a physician or clinician would result in medical care. Otherwise, the other 3 require a discussion.
Thank you.
Great discussion. I imagine this is going to be on our agenda every time we meet. But moving us on, we have about 15 more minutes in this section and a few more items. So maybe we can move along a little bit more quickly. The next item was input discussion on public health fees. I don't know if there's any new information on that. I think the Board of Health and I guess it wouldn't be the Board of Health so much as the County Council is supportive of fees covering the cost of the services. Jeff, is there anything you want to add?
Nothing new to add. We had the work session with the Board of Health on the 23rd. We've talked about it with PHAC and some technical advisory committees. The good news for the 2026 fees is we're in a position where we can use some of our fund balance to mitigate the cost increases to industry and ratepayers.
Great. Thanks a lot for that. And then input discussion on the 2026 public health budget. I'm looking at you again, Jeff.
We do have a balanced budget. It does include some reductions in staffing. It is a difficult process. Again, we have a broken budget construct, and that's not strictly related to Clark County or even Washington State. It's a national issue for public health.
Just to follow up on those staff reductions, were those positions not vacant and not hired, or where are those reductions coming from?
So as of right now, we've identified 8 vacant positions to be eliminated, and we're not quite balanced. We're on the precipice of balancing the budget. Time is of the essence. The budget's due August 11th, so we need to make some decisions here towards the end. So
it'd be interesting to know areas those. I mean, it makes it less personal and painful if it's a vacant position, but the position itself may be a critical position. So it'd be good to understand that a little bit better.
Yeah, I can say a few of them have never been filled. They were added with foundational public health services and have never been filled. We were sitting on them, I would say. I can talk a little bit. We had a program. I mean, I don't want to get in the weeds too much. We had a program coordinator vacancy in our emergency preparedness program. We've got 3 positions in our environmental public health division, all vacant. We actually are eliminating a part-time nurse from our Cowlitz NFP program due to a reduction in federal funding for that program. We had a vacant coordinator, sort of like an assistant manager for our communicable disease program. That's vacant also.
Okay, I think that's deep enough in the weeds for now.
Sorry.
But if I can add, we left those positions vacant because we were concerned about the upcoming budget challenges for 2000. It wasn't that we just,
right.
I mean, we sat on them, but we sat on them for good
Yeah, we had positions become vacant once we understood the budget crisis coming. And those are the ones that had been filled and then became vacant. We do that analysis with every vacant position, regardless of how it's funded or where it's at. in the agency, we look at what our budget forecast is looking like and how critical is this position. It's obvious we'd much rather eliminate a vacant position than tell someone your job is ending.
Great. Well, that's a good perspective to have. I might ask you this question again in the context of the council meeting. Okay.
I just have a comment.
Yes, please.
I just want to thank Jeff for keeping the FAC well informed about the budget process and understand that it's a very difficult budget process. And he's done a really nice job in trying to explain that and have us understand the process and having us make recommendations back if necessary. And we felt comfortable doing that. But Jeff has done a good job with keeping us informed about what's going on during this time. So I want to thank him for that.
Thank you, Sandy, and thank you, Jeff.
There is one more thing I want to add.
Yes.
I've been here a really long time, and we've looked at every possible budget strategy there is to mitigate human impact. We've reduced our physical footprint in our building. Years and years ago, we eliminated our fleet, which saved us a couple $100,000 a year. We do everything we possibly can, even down to eliminating a shared copy machine that was on a lease. We really look at everything, trying to have a positive impact on our budget and, not have as much human impact as possible.
Great, thanks. I ask because I think it's important for the public to understand that we've tightened our belts as much as we possibly can, and the needs are increasing. So it's good for the public. If we're looking at trying to find additional funding, that's a rationale we have to explain. Okay. Yes, go ahead. Oh,
See that far? No.
it looks like there's a hand up. Oh, it's never come down. Okay. Thanks for noticing. So Dr. Melnick, you brought up, there's other issues of public health significance, but we listed a few of them out before we started. So Dr. Melnick, you mentioned RCWs and WACs.
I think I already did that when I was talking about the immunizations.
Okay, and you'll keep us apprised on that as we approach the legislative session.
We're working with our state partners on that to really and it's going to be on the issue for our state association agendas coming up.
Great. Then the other issue that I had made note of is the Board of Health model that could include the Board of Health with additional, with some public health practitioners, as well as having the FAC. Any thoughts on that?
I think the non-electeds are not necessarily public health officials. I think if you take a look at them, and we're going to have Jamie Bowden, who's managing director of our State Association of Public Health Officials, talk about how they're put together in other parts of the state. But the ones I don't know that they have public health officials as non-elected members. They have community members on there.
Great, thanks for that clarification. This was an issue actually that came up because Councillor Young and I attended the WSALFO training, and it was really a great training. I think there's a couple of Board of Health members that are going to be attending this year. But just to understand, there's a range of ways to structure this, and it would be good to maybe take a look at that.
I believe that might be an agenda item for our conversation for the next meeting that we have with you folks in September.
Okay, that sounds great. And when would Jamie be attending that meeting? Would it be?
It's my understanding that she's doing a training for the Board of Health prior to that September meeting, and I don't know the date for that. But then we thought that after that training, our next meeting together would be a conversation about those models and how we might consider moving forward.
Great. And if any member of FAC would like to be in the audience and listen to that training with the Board of Health, you're all welcome. Any other comments related to that?
Yes, I would just add that in my personal views, I'm really dependent on your input on this. So please take it I know you take everything seriously, but really have a robust conversation, and I really will be paying close attention to your deliberation and recommendations on this issue.
There's also, did we mention that there's going to be another local boards of health training this fall? And FAC members, WASAFO is paying all the costs, lodging and transportation. I believe, Councilor Young, you're attending.
Councilor Fuentes is attending as well.
And I think if we can get as many FAC members, I'll be attending, as many FAC members there as possible, it'd be great. I think we just sent a message out to all of you as well.
They've done this, I think, the last 3 or 4 years, and I don't know what their outlook looks like for funding. But if you want to attend the training, you better go now, I think, than wait for a future opportunity. Okay, great. And so Columbia River Mental Health. So I think the public has been watching that and wondering and hoping. So if there's any update you can share, that'd be great, Dr. Fisher.
Yeah, absolutely. So I'm Kevin Fisher, as a FAC member and also the Chief Medical Officer at Columbia River Mental Health Services. We provide both behavioral health and substance use disorder treatment along the Fourth Plain corridor. In March, we had a pretty dramatic financial crisis that required us to furlough about 70% of our operation, including all of our mental health services. And for a time there, we were uncertain whether the methadone clinic would continue operating. The Cowlitz Indian tribe had come forward with a gift of $1.6 million that allowed us to continue operating, and then additional monies later that allowed us to bring back our mental health services. And over the course of the late spring and summer, the organizations worked on a letter of intent, which became public a few weeks ago. And essentially how it's going to work out is that Columbia River Mental Health Services will close operations on September 30th, and all approximately 180 remaining employees will be laid off, and many of them have the opportunity to apply for similar roles in the Cowlitz Indian Tribe Health and Human Services Corps, and so at this point, not speaking for Cowlitz, but the intent, I believe, is for them to acquire Columbia River's buildings as part of that. And so there will be continuous operation of the North Star Clinic. That won't be disrupted. And I believe the plan is to do similarly with the mental health services. Yeah, so try not to speak for them on their side. Yeah.
Thank you. Are there any questions?
I have a question, if you can hear me.
Yes, we can hear you now.
Oh, great. Okay, my question is whether we should try to pursue a MOU with the Cowlitz tribe to just ensure that minimal services are provided. I had seen that one of the Hazeldale facility was going to be closed, and it just concerned me that I know they're committed to it. They said it in the paper, but I just wanted to see if there's any way we can put on paper that certain services will be covered.
I'm not, would that be from the Board of Health or the County Council? I'm not sure if a MOU is applicable. We could look into that.
Yeah, I was hoping we could kind of look into that.
Yeah, I don't know how we would address that. I mean, the funding is not coming from Clark County, so it's essentially it's private enterprise at this point.
Yeah, definitely. But they have a unique services, and if they weren't able to cover everybody, we would need to know that and provide alternatives. So I'm just wondering if we could get some kind of agreement of what services they will cover and what segment of our population. Just investigate whether we can put some things down on paper in good faith.
To me, I think it would be, I don't know if there would be anything on paper. To me, it would be more about relationships and working with them and inviting them to PHAC, or to our Board of Health meetings for a discussion and maybe just have those conversations about what they do intend to do and then advocate for things that we feel are important for the community that they may not be focusing on.
Yeah, discussion could work as well, or invite them to this meeting. I just want to make sure that this transition, we don't leave anybody behind, especially with offices being closed.
Definitely agree there. So whatever we can do definitely is worth working on.
Okay, but I do think it might be worthwhile to invite the tribe to communicate with us. And, I think it's clear this is important service to the community. And I think personally, and we've expressed as a county council gratitude for them stepping up and providing funding. And it would be good to learn more about what their vision is. So I think at a minimum, let's solidify that relationship.
Definitely.
Okay, so Dr. Fisher, I hope you were able to retain your job.
Thank you.
I think we all do.
Okay, well, we'll stay tuned on that. Okay, PFAS was something that Councillor Little and Camus, I think in particular their well, although I think there's more wells that have been impacted by that. Does anyone have any information on PFAS, or how does the health department interact with that issue?
How much information do you want? I could talk to you for 2 hours probably.
I think we
Can I
have
add a
just
little
maybe a couple of minutes. Yes, go ahead.
Can anyone hear me? Okay, I just wanted to
Yes, we
read my
can.
question that I put in the chat. So well 13 in Camas tested at 32.6 parts per trillion, which is 8 times the federal action level at 4 parts per trillion, yet the well has been turned on since May and won't likely be turned off until September when it goes down. So I was wondering if we have any say as the Board of Health on this issue and whether we recommend that well 13 be turned off immediately. I'm really concerned about families in my district drinking this water right now. And it's very hard to mitigate, very hard to filter. So most people are drinking it right now and they might not even know it.
So PFAS are very, very widespread throughout our aquifers here in Clark County, unfortunately. The city of Vancouver has tested multiple sources that are positive for PFAS. Many of those sources are over the 4 part per trillion maximum contaminant level. The state is currently operating under a state action level, which is 15 parts per trillion. There's two. That's where I don't know how much to get into this. There's two primary PFAS that are of concern, PFOS and PFOA. PFOS, there's a state action level of 15 parts per trillion, and PFOA is 10 parts per trillion. So PFAS are everywhere in our environment, carpets, upholstery, all kinds of stuff that we are around and breathe. So humans are exposed to PFAS many different ways. Drinking water is just one of those pathways into the body. It's a chronic contaminant. Fortunately, in the case of Camas, they are able to turn that well off most of the year. And due to the fact that it is a chronic contaminant, although, that 30 parts per trillion number sounds alarming, I don't know. It's been shown that it's not significantly high given the chronic nature of PFAS. And Dr. Milner may be able to talk about that a little bit more. But there's there's multiple sources. Camas is just one of those places. There's multiple sources in Vancouver that have tested positive for PFAS, and all these utilities are making efforts to eliminate PFAS from the water supply. Camas is designing a treatment system. The city of Vancouver is designing multiple treatment systems and has put one of those treatment systems out to bid already for construction. So yeah, there's a lot to this subject, and the utilities are doing everything that they can to remove it and get rid of it. Is all I can say, I guess.
Okay. Well, I read that too, that they're working on it. It will happen in 2027. But my concern is about well 13 right now, because it's basically an extra well for demand in the summer. And there could be actions taken to reduce water and turn. That one just scored so high compared to the federal levels that I would hope that we could do something. And I was just wondering what our authority was over action on that, or do we have no say?
I think Dr. Melnick has a response, unless you have a response related to our authority. Thank you for that information, though. Go ahead, Dr. Melnick.
Yeah, so we have a lot of information on PFAS on our website, and we can make a presentation to the both PHAC and the Board of Health. I think we have before, but we do have information on how people can reduce their risks of PFAS. It is, I mean, I agree with Tyler. It's kind of ubiquitous given how it's been used, and I get that we have this particular well issue, but there are water filters that people can install under their sink. I don't believe they're hugely expensive, but there are ways that people can reduce their exposure to PFAS. I'm not recommending bottled water. I think there's some bottled water, given that PFAS is all over the place, that may contain PFAS itself. And then you got the other issue around plastic and all that with bottled water. So, but we can look more into it, Councilor Little, and get back to you on that and make a presentation both to the, bring that to PHAC as well as Board of Health.
I think a presentation would be good. We had one previously, but an update would be great. And related to Councilor Little's specific question on whose authority would it be to close that well?
It's the State Department of Health oversees the
State Department of Health?
Yeah, they oversee the rules and regulations for drinking water utilities in the state. They're authorized through the EPA to have that authority. And so they're the ones that make the rules and the settings and stuff like that. And it's complicated.
It's a Group A system, right? So we get involved with Group B systems. We inspect those, but Group A, the larger systems, correct me if I'm wrong, those are evaluated by the state.
Correct.
Okay, thank you. Are there any precedents of the state shutting down wells that are this high? And could the city take action to restrict water use on lawns, for example, so that we could not use well 13 at this time?
That might be a question for if this is within the city of Camas, that might be a question for the city of Camas, but you do raise a larger issue related to drought in the county, and that might be something we want to get an update on, because I was just informed that the East Fork of the Lewis River is now at lethal conditions for salmon because of temperatures. So we might want to look more broadly at the drought conditions and the need for this particular well, just as a broader issue that I'm concerned about. Go ahead, Councilor Young.
Yes, thank you, Councilor Little, for bringing that up. I think this is something that should be discussed. And this, I think in the last time that you presented to us, this whole thing is still a bit ambiguous. Like, when we're talking about parts per trillion and it's elevated and stuff, I mean, how bad is this? Is it one glass of drinking it is having a significant health impact, or does it take year after year after year of that ingestion? So, I mean, how big? It sounds alarming on paper. Is it alarming? Is kind of the question that I'm leading to is, what kind of a level of health risk are we seeing from this?
Well, and besides drinking water, we're ingesting PFAS every day in all the products that we are surrounded with.
Yeah, we can come back and do another. That's absolutely correct. And we've been ingesting it for years. It's ubiquitous. It's been used in waterproof materials, firefighting foam. I think even like waterproof, clothing has it. I mean, it's nonstick cookware. It's pretty ubiquitous, and the other difficult. There are a lot of challenges with this because it's not like it's not easy to evaluate the cause and effect in terms of individuals because it's over many years. And if you get a blood test on somebody and measure PFAS levels, there's no correlation between that and what, potential health effects are. So it's difficult. We certainly need to eliminate it. There's no doubt about that. It's not good for you. It's associated with, increased cholesterol levels, certain kinds of cancers, autoimmune disease. But it's a pretty complicated question. And you're right, drinking a glass of water from that well right now is not going to be an imminent, instant serious health risk. But over time, it's very concerning.
Thank you, Councillor Little, for raising this. There's a lot more, I think, to discuss with this than we have time today, and we can do some exploration, I think, maybe with Jordan's assistance on what it takes to close a well and, what that means and just in terms of availability of water for that community. So we have, I think,
Sorry, I just wanted to add in that analysis, if we could reach out to the state department and ask them specifically what they would recommend in the summer to do with Camas Well number 13. And also, we just have to be really careful about what we say about how much an impact of a glass of water versus more is without it being very scientifically based. So just want us to be
right. This might be an issue to bring back to the county council as well, if we're going to be taking some action. Okay, thank you. We have, I think, 2 minutes now to talk about summary and next steps. First, I'd just like to ask folks, has this format been worthwhile? Is this good? Do we need to change things? This will, I think, be an ongoing quarterly gathering of us together. Any feedback?
I guess I'll just say I really enjoyed having the opportunity to have this kind of an open conversation about the issues that are brought before us in PHAC, as well as what's presented to you at the Board of Health, and appreciate having that. I think over time we've not been able to have that opportunity or didn't make it happen, and it allows us to have more direct conversation about the impacts and our concerns within the community. So I really appreciated the opportunity and looking forward to the future ones.
Great, thank you. Go ahead, Councillor Young.
From my perspective, I feel like this is valuable and worthwhile. One of the things that I would like to explore, though, is when we hold these meetings so that we can get higher level participation. So evenings, possibly, but explore to see how we can get more people to come.
What is the representation from PHAC? I mean, do we have 50% of PHAC members? We don't have 50%.
We need
We counted, and I think we have maybe 14 present out of the 21.
14 out of 21. Well, not bad. Any other thoughts? Dr. Melnick?
Maybe it's me, but I've just been really excited just about having the conversation between Board of Health members and PHAC. And I think I've learned a lot here, and I'm really looking forward to continuing this.
I
Go
can
ahead.
remember, I've been a long time member of FACT where we'd maybe meet with the county commissioners once a year. And so I think the frequency of us meeting is great.
Oh, they didn't hear you.
Yeah.
No, I appreciate the frequency of meeting, years past. It was maybe an annual meeting or communication by letter. So
Right.
I think this is great.
Yeah, I like the give and take. I don't know how the agenda was put together, but I think maybe if reaching out to both the Board of Health and the FACT to gather agenda items or issues would be helpful. Okay, so we're at time now. Thank you all very much for your participation. We have some things to follow up on that I think the people who are following up on those things have made note of. So at that point, I'll see you in a quarter and have a great summer. We'll adjourn.